Hello and welcome. Today, we're diving deep into a common, yet complex, nervous system disease of major depressive disorder, often simply referred to as depression. We'll explore its causes, how it affects the brain, and what we can do to understand and manage this condition. The exact cause of major depressive disorder is still not fully understood, but it's believed to be a complex interplay of genetic, biological, environmental, and psychological factors. Genes can predispose someone to depression, making them more vulnerable, but they don't guarantee its development. Biological factors include imbalances in neurotransmitters, the chemical messengers in the brain, such as serotonin, norepinephrine, and dopamine. Stressful life events, trauma, abuse, loss, and major life changes can all trigger depressive episodes, especially in individuals with a pre-existing vulnerability. Finally, negative thinking patterns, low self-esteem, and a pessimistic outlook can contribute to the development and maintenance of depression. Depression significantly impacts brain function. Neuroimaging studies have revealed structural and functional changes in several brain areas, including the prefrontal cortex, responsible for decision making and emotional regulation, the hippocampus, involved in memory and learning, and the amygdala, which processes emotions like fear and sadness. In depression, the prefrontal cortex often shows decreased activity, leading to difficulties with concentration and motivation. The hippocampus may shrink in size, potentially affecting memory, and the amygdala may become overactive, amplifying negative emotions. Furthermore, the communication pathways between these regions can become disrupted, contributing to the widespread symptoms of depression. These changes are often associated with reduced levels of key neurotransmitters. Major depressive disorder is a widespread concern. It affects millions of people worldwide, across all ages, ethnicities, and socioeconomic backgrounds. The World Health Organization estimates that over 280 million people globally suffer from depression. Women are diagnosed with depression at roughly twice the rate of men, though this may be partially due to reporting biases. While it can occur at any age, it often begins in adulthood. Depression is a leading cause of disability worldwide, significantly impacting individuals' quality of life, relationships, and productivity. The signs and symptoms of major depressive disorder can vary from person to person, but generally include persistent feelings of sadness, emptiness, or hopelessness. A loss of interest or pleasure in activities once enjoyed is a hallmark symptom. Changes in appetite, leading to weight loss or gain, and sleep disturbances, such as insomnia or excessive sleeping, are also common. Other symptoms include fatigue or loss of energy, difficulty concentrating, making decisions, or remembering things, feelings of worthlessness or guilt, restlessness or slowed movements, and recurrent thoughts of death or suicide. It's crucial to remember that everyone experiences these feelings occasionally, but in depression, they are persistent, pervasive, and significantly interfere with daily life. Diagnosis of major depressive disorder typically involves a comprehensive evaluation by a healthcare professional, such as a psychiatrist or psychologist. This evaluation includes a thorough review of the individual's symptoms, medical history, and family history. The clinician will use standardized diagnostic criteria, outlined in the Diagnostic and Statistical Manual of Mental Disorders, or DSM, to determine if the individual meets the criteria for depression. Physical examinations and lab tests may also be conducted to rule out any underlying medical conditions that could be contributing to the symptoms. The assessment aims to understand the severity and duration of the symptoms and their impact on the individual's functioning. Major depressive disorder can be further classified based on its specific features. For example, major depressive disorder with melancholic features involves a profound loss of pleasure in almost all activities. Major depressive disorder with atypical features includes symptoms like increased appetite, hypersomnia, and sensitivity to rejection. Major depressive disorder with seasonal pattern refers to depression that occurs during specific times of the year, typically winter. Persistent depressive disorder, also known as dysthymia, is a chronic form of depression with less severe but longer-lasting symptoms. Understanding these classifications helps clinicians tailor treatment plans to the individual's specific needs. Treatment for major depressive disorder typically involves a combination of medication and psychotherapy. Antidepressant medications such as selective serotonin reuptake inhibitors or SSRs, serotonin norepinephrine reuptake inhibitors or SNRs, and others can help regulate neurotransmitter levels in the brain. Psychotherapy such as cognitive behavioral therapy or CBT and interpersonal therapy or IPT can help individuals identify and change negative thinking patterns and improve their coping skills. Lifestyle changes, such as regular exercise, a healthy diet, and adequate sleep, can also play a significant role in managing depression. In some cases, other treatments like electroconvulsive therapy, or ECT, or transcranial magnetic stimulation, or TMS may be considered. While preventing major depressive disorder entirely may not always be possible, there are steps that can be taken to reduce the risk and promote mental well-being. Building strong social support networks, managing stress effectively, practicing mindfulness and relaxation techniques, engaging in regular physical activity, and maintaining a healthy diet are all important. Seeking help early when experiencing symptoms of depression can also prevent the condition from worsening. Promoting mental health awareness and reducing stigma around mental illness are crucial for encouraging individuals to seek help when they need it. The prognosis for major depressive disorder varies depending on individual factors, such as the severity of symptoms, the presence of other medical or psychiatric conditions, and adherence to treatment. With appropriate treatment, many individuals experience significant improvement in their symptoms and are able to return to a fulfilling life. However, depression can be a recurrent condition, and some individuals may experience chronic symptoms. Recent research is focusing on developing more targeted and personalized treatments for depression. This includes exploring the role of genetics, biomarkers, and neuroimaging in predicting treatment response. Novel therapies, such as ketamine and psilocybin, are also being investigated for their potential to rapidly alleviate depressive symptoms. The future of depression research holds promise for developing more effective and personalized interventions.